Hi, I'm Dr. Chuck with Your Filthy Mouth. Today we're going to be talking about diabetes and your mouth. Is there a link? Stay tuned.
Your smile is beautiful and possibly deadly. Dr. Chuck is here to tell you how your mouth can hold the key to your overall health. Now, about that filthy mouth of yours.
Hi, and welcome to Your Filthy Mouth. I am Suzanne Lynn with Dr. Chuck Reinertson, and we are here to share about things happening in your mouth and how it affects the rest of your body. Before we move on, we always encourage you, would you just subscribe so you don't miss any episodes? It's important, right, that your friends and family and your whole network get to know about this. So today we're going to be talking about diabetes and how it's related to your mouth and how
It's amazing. Whatever comes into our mouth has an effect on the rest of the body. If you think about it, your mouth is the front door to your body. Physicians are real quick about having your back door checked, right?
Right.
You get colonoscopy. This is the front door where everything is coming in. So what we want to do is help people understand not just how it affects in diabetes, but so many other cardiovascular disease, rheumatoid arthritis, pregnancy complications. Today we'll talk about diabetes, though. And yeah, there's a direct link.
All right, well, let's start with that.
Well, the bacteria in the mouth cause inflammation.
Okay.
Inflammation is one of the things that affects so many different parts of the body. And with diabetes and gum disease, periodontal disease, it's a two-way street. And I'm going to read just what the American Diabetes Association, this is their quote right here. Emerging research suggests that the relationship between serious gum disease and diabetes is a two-way. Not only are people with diabetes more susceptible to serious gum disease, but serious gum disease may have the potential to affect blood glucose control and contribute to the progression of diabetes. Research suggests that people with diabetes are at a higher risk for oral health problems such as gingivitis, is an early stage of gum disease, and periodontitis, which is serious gum disease. People with diabetes are at an increased risk for serious gum disease because they are generally more susceptible to bacterial infection and have a decreased ability to fight bacteria that invade the gums.
Okay, so break that down into my terms for me.
Okay, first of all, this is not from a dental organization. This is from the American Diabetes Association.
Okay.
They understand that whenever you have maybe a decreased ability to fight certain bacteria, you can have more inflammation, and that affects, again, a lot more than just the gums. It affects the entire body. They're showing just how much inflammation plays a role in so many different diseases. If you're affecting the pancreas' ability to produce insulin or to regulate your blood sugar, that's going to affect everything. Now, can the diabetes make the gum disease worse? Yes, that's what they're saying.
Okay, that's the two-way street.
The diabetes can make the gum disease worse. The gum disease can make the diabetes worse.
I get it.
Okay?
I got it.
So if we can make the gum disease better, it's going to make the diabetes better. Okay? If we make the diabetes worse, it's going to make the gum disease worse.
Okay.
If we make the diabetes better, it's going to help on the gum disease.
It's all linked.
It's a two-way deal.
So I'm guessing, today's show is about diabetes, but it's probably pretty comparable when it comes to heart disease and Alzheimer's, and it's a two-way street.
Thank you.
Right.
Thank you.
Okay.
We tend to focus on just one disease because we have in medicine that's broken down into, well, you take care of the diabetes and you take care of the lungs. And
You
take
sit
care of
in
the
this
heart,
chair for this one, and then
Yeah.
yeah.
But it's all inclusive. So we can't say it's just on this. So, and when they say that you need a healthy mouth to have a healthy body, which I completely agree with, but you also need other things. If you're going to bake a cake, you might need eggs, you need flour, you need whatever all the ingredients are. It doesn't mean you only need eggs. It doesn't mean you only need flour. Okay, you need all these other things. Well, to have a healthy body,
It's a team.
you need a healthy mouth. Okay, it doesn't have to be a Hollywood smile, but no infections going on.
Right.
You need to eat properly. Okay, you need a little bit of exercise in there, and you need a good attitude too. So even though we need these things, it doesn't mean that's all we need. We need a combination of things.
All right, two-way street.
Two-way
Totally
street.
get that. The thing that really surprises me is that you talk a lot about how diabetes and cancer and Alzheimer's, there's no pain with that.
That's amazing. And the older I get, the more I like pain. What I mean by that is I never want to cause pain.
Right.
That's never. Right. Okay. However, pain is the best motivator I have ever found. You have people, they've got a problem going on, but there's no pain. So in their mind, there's no problem.
Right.
If everything feels good, it must be okay. high blood pressure, diabetes, glaucoma, cancer, no pain for years. And then all of a sudden they're diagnosed as
Right.
stage 4 cancer. Well, there was no pain. It didn't
Right.
hurt. So, lack of pain doesn't equal health. And
Right.
that's a real important, I'm glad you brought that up.
Yeah.
That's a big deal.
And there's consequences for not taking care of this. I mean,
Well, everything that we do in life has consequences.
Right.
Everything. Either good consequences or bad consequences. If you study for the test,
right.
okay, the consequences are you're probably going to do pretty good on the test.
Right.
Okay. If you don't study for the test, there's consequences for that too. If we take care of ourselves, there's consequences. If we don't, there's consequences. It's amazing how long sometimes it takes things to hit you. And what hit me finally just a couple of months ago is every cavity that every person has ever had is where we were doing a poor job in removing the bacteria from our teeth, the plaque. Because you have to have the bacteria, you have to have the acids to produce to destroy the enamel that's on the teeth. And so many of us, we thought we were doing a good job.
Sure.
Okay. And we thought we were maybe eating right. But maybe we weren't. And maybe we were leaving a whole lot more behind than we thought. Effort doesn't always equal results. You have to be the proper effort.
So what I'm taking away from today's show is specifically with diabetes, but generally speaking, things are a two-way street. If you have a bad mouth, it's affecting the rest of your body. And if you have disease in your body, it may make your mouth more susceptible to having problems.
That's absolutely right.
Right.
Especially with diabetes. They've already shown that link right there.
Okay.
So, get a healthy mouth. I'm repeating myself. But you don't have to have a Hollywood smile. You have to start with just the health. Take care of the infections. Make sure you have an open airway. Make sure that you have a bite just right. So anyway, those are the basic things that we need to do. So it's up to you. It's up to me.
All right, we're going to be back with the question of the week.
Here's Dr. Chuck's question of the week.
And welcome back to Your Filthy Mouth. We're asking the question from Danielle this week. And this is personal for her because she has had a history of breast cancer. And she wants to know, how safe are dental x-rays?
That's a great question. And we hear this all the time. I'm going to tell you, today they're way safer, much safer than they were many years ago. Back when I was in dental school, they used a regular film. And then they actually increased the speed of the film. And they went from regular film to something called ultra-speed film, which used 1/10 of the radiation that we use in the regular film.
Oh, wow.
Then they came out with digital, which uses 1/10 of what you had on the ultra speed.
It's
film.
going in a good direction.
So
Yeah.
so the amount of radiation that you're getting from dental X-rays, oral X-rays, is this big. When you're taking it like a chest X-ray, you've got to go through a big area, a great big thickness.
Right.
When you're going through just a little bit of tissue here and then the bone on the teeth right there, it doesn't take that much. Plus, it's a much smaller area. So years ago, that was a big issue. You'd have to take an awful lot. We had a radio oncologist talk to our group one time. And he said, "Is there anything I can do to help you, dentists?" And we said, "Yes. Would you please inform your patients that dental X-rays are actually okay after they've had radiation treatment?" And he was like, "Well, they don't think that's okay?"
Oh,
And-
it was just assumed.
yeah.
Yeah.
And
okay.
he said, "No." And he said, "Well, radiation treatment is like an Olympic swimming pool full of water.
Okay.
Dental X-rays is like one drop."
That's good to know.
Okay.
Danielle.
So, yeah, you're okay.
Yeah, you're good. Good to go. That was a great question.
Yeah,
Thank you.
very good.
All right. Well, it's time to review the 3 points about diabetes tying in with the overall health of your mouth.
Okay.
Point number 1. What's our takeaway for number 1?
Well, it's a two-way street. Whatever happens in your mouth affects the rest of your body. With diabetes, whatever happens with your diabetes affects your periodontal disease. And that's not my ideas. Again, look, check out the links. We're not making this stuff up.
Number 2 point is that there's no pain.
Absolutely no pain. And oh man, I wish there was. I'm not into pain,
Right.
but it's a wonderful motivator. Lack of pain doesn't motivate. When you get that splinter in your foot, you can't wait to get it out. But if it doesn't hurt, it sits there.
So no pain doesn't mean you don't have mouth problems or diabetes or other kind of problems.
Exactly.
And the third one, there's consequences.
Everything we do in life has consequences. If you have proper home care, the consequences are you're not going to get so many cavities. Your gums are going to be healthy. You're going to have fresh breath. You're going to all those good. If you don't, you're going to have consequences not just in your mouth, but you can have consequences that affect the rest of your body. So yeah, controlling your diabetes will help your gum situation. Helping your gum situation will help your diabetes. So everything has consequences. Just make sure they're positive consequences.
You know what? You go to Your Filthy Mouth. We're going to post a link to how diabetes and a healthy mouth are all related. We'll show that link.
Yep.
And we just want to thank you for being part of Your Filthy Mouth. Be sure to subscribe. Tell your family and friends how important it is to have a healthy mouth for way more than just clean mouth reasons. Right?
Yeah, we have a health crisis in this country. And this is one of the ingredients that we need to address. So ask your physician, tell your neighbors, look at this, spread the word. All we're trying to do is connect the dots between the mouth and the rest of the body.
That's what we do. Thanks for joining us on Your Filthy Mouth.
This has been Your Filthy Mouth, a weekly podcast about how what happens in your mouth affects the rest of your body. This is important information, so please share it with your friends. Don't forget to hit the subscribe button on YouTube, iTunes, and all the other podcast sites. And drop by yourfilthymouth.com to ask Dr. Chuck a question or find dozens of links to information about oral systemic health. We'll talk to you next week.